Wegovy and Zepbound have a thyroid cancer warning, but here is what most people get wrong. This warning does not apply to everyone. It targets two specific conditions: medullary thyroid cancer and a rare inherited syndrome. Most people taking these drugs have neither of those. The real question is whether you are actually in that group, and the answer for most people is no. Here is what most people misread right away. This warning is not about every thyroid problem out there. It is about one specific cancer called medullary thyroid cancer. That is completely different from the thyroid conditions most people actually have. Personal or family history of medullary thyroid cancer puts you inside the warning. So does a confirmed diagnosis of multiple endocrine neoplasia type 2, a syndrome linked to that cancer. Without either of those, you are likely outside the highest risk group named on the label. Hypothyroidism affects millions of people. Thyroid nodules are extremely common too. None of those are what this warning is targeting. These drugs cause C-cell tumors in rodents, and that created the warning. It did not prove the same risk applies in humans. I'm Dr. Kim. This is not medical advice. Consult your doctor. Wegovy contains semaglutide. Zepbound contains Tirzepatide. Both are used for weight loss and approved for related conditions. C cells are thyroid cells that produce calcitonin, a hormone that helps regulate calcium levels. The rodent tumors justified caution. They did not prove the same thing happens commonly in humans. Here is what makes that gap important. Human thyroid C cells are sparse. They also appear far less responsive to these drugs than rodent C cells. The rodent data created the warning. It did not establish that the same risk applies equally in people. Those are two different conclusions from the same experiment. The warning does not cover every thyroid problem. Hypothyroidism, an underactive thyroid, and Hashimoto's disease, an autoimmune condition, are different categories. So is Graves' disease, an overactive thyroid condition. These are not minor distinctions. Each one involves different cells and a completely different conversation with your doctor. Getting this wrong is one of the most common ways people misapply the label. These drugs also do not appear to disrupt standard thyroid hormone levels in most people. Studies have not shown consistent changes in TSH, a measure of thyroid hormone activity, or T4 in average risk patients on these drugs. The thyroid concern is about C-cell tumors. It is not about the hormone axis that most thyroid patients track with routine blood work. That is where many people get pulled off track. They hear thyroid, remember a blood test, and assume the boxed warning applies to them. Usually it does not. The boxed warning was not built for them. There are actually two separate mistakes people make here, and both lead to the same bad outcome. The first is misreading which thyroid conditions this warning covers. The second is coming up next. Here is the uncomfortable truth. Most people do not stop Wegovy or Zepbound because of cancer risk. They stop because they cannot tolerate it, cannot afford it, or cannot stay consistent. And most of them never saw it coming because they were focused on the wrong risk the entire time. Real-world data shows that most patients on GLP-1 drugs discontinue within the first year. Cost, side effects, and inconsistency are the actual culprits, not a cancer warning. The label rarely comes up when someone decides to quit. Ask 3 questions. Do you personally have this cancer? Does a first-degree relative have this cancer? Has multiple endocrine neoplasia type 2 been confirmed in you or your family? Those are the questions that turn this warning from background context into a real stop sign. That syndrome, multiple endocrine neoplasia type 2, is rare and inherited. It is usually identified through genetic testing, a strong family history, or both. For that group, the warning is not vague legal language. It directly changes whether these drugs should be used at all. One point worth knowing, this same boxed warning applies across the entire GLP-1 drug class. Wegovy carries it. Zepbound carries it. This is a class-level caution. This cancer and syndrome question applies to every drug in this class, not just one of them. For everyone outside that risk group, the decision becomes a benefit versus burden judgment. Is blood sugar control improving, appetite lower, and weight dropping? Are side effects tolerable? Can you afford it and stay on it long enough to see real results? What doctors actually watch in practice is different from what patients research at home. In the clinic, the focus is on tolerability in the first 8 weeks. Dose escalation pace matters, so does whether the patient has enough support to stay on track. Cancer risk comes up in the intake history, and after that the conversation moves on. That brings us to the second mistake, and this one is more common than the first. People spend weeks researching a cancer warning that does not apply to them, then try to resolve it with the wrong tests. Meanwhile, the real reasons treatment fails go completely unexamined. Routine thyroid labs do not resolve this question. Standard tests measure hormone function, not cancer risk. A normal TSH does not erase the warning. An abnormal thyroid result does not place you in the boxed warning group. These are separate pathways in the body. Calcitonin testing sounds more targeted, but false alarms are a real problem in average risk patients. Routine thyroid ultrasound has the same limitation. None of that helps if you were never in the high-risk group to begin with. Fear distorts the picture here. A dramatic boxed warning pulls attention toward a rare possibility. Meanwhile, the common reasons treatment fails keep doing damage in plain sight. Poor protein intake, rapid dose escalation, and early dropout decide outcomes far more often than any rodent study does. The warning does not make symptoms less real. A new neck mass, persistent hoarseness, or trouble swallowing all deserve proper evaluation. Those symptoms are not unique to this cancer, and many other causes are far more common, but they still require real clinical assessment. Do not rely on internet self-diagnosis for any of them. Human data so far is more reassuring than the warning language suggests. The label still states it is unknown whether these drugs cause thyroid C-cell tumors in humans. The risk has not been proven common, but it has not been ruled out either. That uncertainty is why the label stays cautious. Caution on the label is appropriate. Extending that caution to every person with any thyroid history is not. That is where the real decision lives. The people most likely to succeed on these drugs are not the ones who studied the label the longest. They are the ones who managed side effects early, built a plan around cost, and stayed consistent when progress slowed. That is what determines the outcome, not the warning. Confirm the risk group. Then judge the drug on benefit, side effects, and cost. Your results answer that question. The warning does not. The label is a screening tool, not a verdict. Use it to rule out a small high-risk group. Then move on to the work that keeps people healthy. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.